All right, so you want to be a radiographer and you've got all this stuff from RoleCatcher, their whole job platform, interview prep, the career guide, a lot to take in, ready to deep dive into it.
It's really interesting material. It's amazing how radiography is both about technology and about people. You're not just capturing images, you're using them to understand a patient's health, and that's powerful.
It's a perfect blend of human connection and really cool tech. And RoleCatcher talks about some pretty futuristic stuff. 3D imaging, molecular imaging, proton therapy. It's like a medical sci-fi novel.
Speaking of proton therapy, how does that actually work? I mean, it sounds so much more precise than traditional radiation.
It is. It's a game changer, especially for treating cancer. Imagine, instead of broadly applying radiation, you can target a tumor with incredible accuracy, minimizing the damage to the surrounding healthy tissue. Faster recovery, fewer side effects, and potentially better outcomes for patients. That's what proton therapy can do. That's amazing. RoleCatcher projects 7% job growth for radiographers, which makes sense, but they also have that con-section radiation exposure, the long hours, the emotional toll. How do you know if you're really cut out for this kind of work?
That's a great question. It's not just about technical skills. You need resilience, empathy, you have to handle the emotional weight. I knew a radiographer once who spotted a life-threatening blood clot on a completely routine scan, just by chance. That wouldn't have happened without that meticulous attention to detail and genuine care for the patient. Those aha moments where you have a direct impact on someone's life, that's what makes it worthwhile.
Wow, I can see how rewarding that would be. Let's talk skills. RoleCatcher highlights reading comprehension and critical thinking, which seem like pretty general skills. How do those actually play out in the everyday work of a radiographer?
They're more connected than you might think. Think about it. Reading comprehension means you can quickly grasp complex medical histories, right? And critical thinking, that's how you adjust your technique on the fly, because every patient and every situation is different. You're a detective, an advocate, and a tech expert all in one.
That's a lot of hats to wear. So quick thinking, connecting with people, these are all important. And RoleCatcher also talks about career progression. What's the secret ingredient to climbing the ladder in this field?
They're spot on when they emphasize networking. I've seen firsthand how connecting with other professionals, finding mentors, it opens doors you wouldn't believe. The American Society of Radiologic Technologists is a great example. Just attending a local meeting could introduce you to someone who could change your entire career path.
Networking is so important in any field. Speaking of which, RoleCatcher's interview prep tool is really impressive. They have a huge database of questions specifically for radiography and even AI feedback. Some examples they include are why radiography and how do you ensure patient safety? Any advice on how to make your answer stand out?
Those questions come up a lot, so don't just give a generic response. Share a real story about what sparked your passion for radiography. Don't just list safety protocols. Describe a time you went above and beyond for a patient. Let your personality come through.
Authenticity is key. Show them who you are and why this field matters to you. So far, we've talked about the demands of being a radiographer, but also the rewards, the incredible technology, the importance of connecting with people, building your network. But there's another layer here. RoleCatcher puts a lot of emphasis on the importance of soft skills for radiographers. It's easy to get caught up in the technology, but they emphasize how crucial empathy and communication are in patient care.
Absolutely. Putting yourself in the patient's shoes, maybe they're anxious, maybe they're in pain, maybe it's just a stressful situation. How a radiographer interacts with them can make a huge difference. Taking the time to really listen, to explain things clearly and simply, and to treat every patient with respect and dignity, that can completely change their whole experience.
It's about so much more than just getting the images. It's about building that human connection. And speaking of the images, the RoleCatcher guide mentions all sorts of amazing technology beyond the typical X-ray ultrasound, MRI, even things like radioactive sources, which I imagine might sound a little intimidating to some people. Can you shed some light on what that means in this context?
It's a perfect example of how radiography brings together physics and patient care. And it's not as scary as it sounds. In this context, a radioactive source might be a tiny, very safely contained amount of radioactive material that's used in nuclear medicine scans. These scans allow us to actually visualize how the body is functioning at a molecular level, which helps diagnose a whole range of conditions that we might not be able to see with traditional imaging.
Wow, so it's really looking at the body from a completely different perspective. We've talked about high-tech treatments like proton therapy, and now these incredibly detailed scans. There are so many directions you can go in as a radiographer. But that also makes me wonder, for someone just starting out, how do you even begin to figure out what you want to specialize in? It's a good question. It can definitely feel overwhelming with so many options. I always recommend getting as much hands-on experience as possible. Talk to radiographers who are already working in different departments. Ask them about their experiences. See if you can shadow someone for a day, even. And definitely look for volunteer opportunities or internships in different areas of radiography that you're curious about. Even if it's just for a short time, that direct experience is invaluable in helping you figure out where you fit best.
That's great advice. Don't just read about it, experience it. And that actually reminds me, earlier we were talking about the emotional toll this job can take. You're dealing with people's health, their anxieties, and sometimes even life or death situations. As a radiographer, how do you manage that weight, that emotional aspect of the job, and prioritize your own well-being? You're touching on something that's so important and so often overlooked. You have to have healthy coping mechanisms and make self-care a priority. This might mean finding a supportive network of colleagues, people who understand the unique demands of the job and can offer support and guidance. It could also mean finding what works for you in terms of stress management. Things like meditation, breathing exercises, or other mindfulness practices can be incredibly helpful. And just as important is having outlets outside of work hobbies, spending time with loved ones, anything that helps you recharge and maintain that balance.
It's that classic saying, you can't pour from an empty cup. You have to take care of yourself in order to be fully present for your patients. Now let's switch gears for a moment and talk about something a little more practical. RoleCatcher goes into some detail about salary expectations, which I imagine is top of mind for anyone considering this field.
Of course, it's important to know what to expect, and RoleCatcher's data suggests that radiography is a well-compensated field overall. Of course, salaries vary depending on where you are, how much experience you have, what your specialty is. But in general, it's a career with good earning potential, and the positive job growth outlook means there's potential for advancement and increased earning down the line as well.
That's reassuring. But beyond salary, what about just general job satisfaction? What makes radiography a career that people are truly passionate about long term?
For a lot of people, it's the combination of intellectual stimulation, working with really cutting-edge technology, and knowing that you're making a tangible difference in people's lives. You're constantly learning, you're problem-solving, and your expertise directly contributes to better health outcomes for your patients. For many radiographers, it's more than just a job. It's a deeply fulfilling career path.
You can really tell that the people drawn to this field feel that sense of purpose. Now, while the overall job market for radiographers seems really promising, RoleCatcher also mentions that the most sought-after positions can be competitive. So how do you make yourself stand out in a sea of qualified applicants?
RoleCatcher emphasizes the importance of a strong resume and really nailing those interviews. And the right gone are the days when simply meeting the minimum requirements was enough. You have to go above and beyond to showcase those unique skills and experiences that set you apart.
So it's not just what you know, it's how you present yourself, both on paper and in person.
Absolutely. And the other thing that can make all the difference is networking, building genuine relationships with people who are already working in the field. Don't underestimate the power of attending conferences, connecting with people on LinkedIn, or reaching out for informational interviews. It can give you a real edge.
It's about making those connections and building a network of support and mentorship that can help you throughout your career. And that reminds me of something else I wanted to touch on. RoleCatcher actually offers some really cool AI-powered tools to help you fine-tune your resume and practice your interview skills, which I think is just amazing.
It's incredible how technology is transforming the job search process. But while those tools are incredibly helpful, ultimately it comes down to your passion, your skills, and your ability to connect with people in an authentic, genuine way. Those are the things that will truly make you stand out.
Technology can enhance the process, but it can't replace that human element. So well said. Now, speaking of technology, we're in a field where things are constantly evolving with new advancements emerging all the time. What are some of the things you're most excited about in terms of the future of radiography?
One word: artificial intelligence. We're already seeing the beginnings of it, and its potential to completely revolutionize medical imaging is just immense. Imagine algorithms that can help with image analysis, detect even the most subtle abnormalities that a human eye might miss, and even personalize treatment plans based on a patient's individual needs and medical history.
It sounds like science fiction, but it also makes me wonder, with all this rapid technological advancement, how do radiographers keep up with it all on top of their already demanding workloads? It seems like a lot to balance.
That's such a crucial point. Continuous learning is absolutely non-negotiable in this field, whether that means attending conferences and workshops, taking online courses, or just staying up to date with the latest research and publications in the field. Radiographers have to be incredibly proactive about expanding their knowledge base throughout their entire careers. It's a commitment.
So it's not just about getting that initial degree or certification, it's about embracing lifelong learning as part of your professional identity.
Absolutely. And honestly, for a lot of people in this field, that's one of the most rewarding aspects of the job. There's always something new to learn, always room to grow and expand your skill set.
That's fantastic. It sounds like a career that keeps you challenged and engaged over the long term. But let's be real, finding the time and resources for all that professional development on top of a demanding work schedule can feel daunting. What advice would you give to someone who's maybe feeling overwhelmed by that prospect?
It's a valid concern. It requires being very intentional about how you manage your time and energy, and it often means going above and beyond your regular duties. That's why finding supportive employers and building a strong network of mentors and colleagues is so important. Having people in your corner who understand those demands and can offer guidance and support makes all the difference.
So, seeking out workplaces that prioritize professional development and actively building those connections within the field are essential.
100%. And I always encourage aspiring radiographers to ask about those things during interviews. It demonstrates your commitment to growth, and it can give you valuable insights into the organization's values.
That's such a good point. It's a two-way street. You're interviewing them just as much as they're interviewing you. Now, since we're talking about navigating the realities of this career, I wanted to ask about something that often causes a lot of anxiety for people who are just starting out: the interview process. RoleCatcher's Guide has some helpful tips, but from your experience, what are some of the most common mistakes you see people making in radiography interviews?
One of the biggest ones, and it's so avoidable, is not doing your research beforehand. It's so important to go beyond just giving generic answers about the field because you've taken the time to learn about the specific hospital or clinic you're interviewing with, their values, the patient population they serve, the types of technologies they use. It makes such a difference.
So, tailoring your responses to show that you haven't just memorized facts about radiography, you've actually thought about how your skills and experiences align with their specific needs and environment.
Exactly. And another really common mistake is overlooking those soft skills that we talked about earlier: empathy, communication, teamwork. Those are so crucial for radiographers, and interviewers want to see evidence of those skills in action, not just hear you list them off.
It's not enough to just talk the talk, you have to walk the walk. Show, don't tell, right?
Exactly. Share specific examples from your experience, times when you demonstrated empathy with a patient, when you navigated a difficult communication challenge effectively, when you collaborated successfully as part of a team. These can be just as impactful as talking about your technical skills.
It's about painting a complete picture of yourself as a future healthcare professional, not just ticking boxes on a checklist. Now, before we move on to our final thoughts, I wanted to touch on one more common interview mistake that I think people often underestimate: the power of asking insightful questions.
Oh, absolutely. The questions you ask at the end of an interview are just as important as the answers you give. It's an opportunity to gather information, yes, but it's also a chance to demonstrate your curiosity, your thoughtfulness, and your genuine interest in the position and the organization.
It's about showing that you're not just there for a job, you're there to learn, to contribute, and to be a part of something larger than yourself.
Exactly. So come prepared with a few thoughtful questions that show you've been paying attention, you've done your homework, and you're eager to learn and grow within their specific environment. It shows that you're already thinking like a member of the team.
It's amazing how we can talk about AI and cutting-edge imaging and then circle right back to something so fundamental. RoleCatcher really emphasizes that no matter how advanced the technology gets, those core interpersonal skills, that human touch, are absolutely essential.
Couldn't agree more. You can have the most sophisticated equipment in the world, but if the person using it isn't treating the patient with empathy, respect, communicating clearly,
Yeah.
it's like you're missing half the equation.
It's about remembering that there's a real person on the other side of that scan, a person with their own story, their own anxieties, maybe going through something really difficult. As a radiographer, you have this opportunity to make their experience a little bit easier, even if it's just for a few minutes.
It might seem like a brief interaction in the grand scheme of things, but those moments matter. A calm demeanor, a clear explanation, even a little humor when appropriate, it can make all the difference.
Absolutely. Speaking of which, we talked about the emotional demands, but The physical side of this job seems like it could be pretty demanding too. Long hours are one thing, but what about the actual work itself?
It's definitely something to be aware of. You're often on your feet for long periods, moving and positioning patients, sometimes dealing with heavy equipment. Strength and stamina are important, and good body mechanics are essential to avoid injuries.
So being physically fit is actually a big part of it. What advice would you give someone who's just starting out, maybe thinking about those physical demands for the first time?
Be proactive. Make sure you're incorporating some strength training. Focus on your core, your back. Flexibility is huge. Don't be afraid to ask for guidance on proper lifting techniques, either from experienced colleagues or even a physical therapist. Think of it this way. Your body is your most important tool in this job, so taking care of it is essential.
That is such a good point. We can get so caught up in the tech that we forget we're physical beings doing this work. Okay, one last question before we wrap up this deep dive. It's something I know a lot of aspiring radiographers think about. In a competitive job market, what really makes a candidate stand out?
Obviously, having the right qualifications, the technical skills, it's a given, but beyond that, it's often those less tangible qualities that really make an impression.
Spill the secrets. What are those qualities?
Enthusiasm. It might sound simple, but you'd be surprised. Interviewers can tell if you're genuinely excited about radiography, if you're just going through the motions. Let your passion shine through. Talk about what interests you, what you're hoping to learn, how you see yourself contributing to the field. That energy is contagious.
So it's not enough to just be competent. You have to be engaged. You have to really want it.
Exactly. And initiative is huge. Don't wait for opportunities. Seek them out. Volunteer at a clinic. Shadow a radiographer. Join a professional organization. Go to conferences. Anything that shows you're proactive and hungry to learn.
That go-getter attitude, it makes a difference.
It does. And finally, build a strong personal brand. This is so crucial in today's world.
So we're talking about LinkedIn, professional websites, portfolios, all that.
Exactly. Use those platforms strategically to highlight your skills and experiences, network with people in the field, share your unique perspective. It's like creating your professional introduction before you even meet someone.
Building that online presence as a thoughtful, engaged professional.
That's it. And remember, your personal brand goes beyond the digital world too. Every interaction you have, from networking events to clinical rotations, is a chance to make a positive impression.
Be your own best advocate consistently. That's great advice.
Well, as we wrap up this deep dive into the world of radiography, I want to leave our listeners with this. We've covered the technical, the interpersonal, the job outlook, the challenges, the amazing rewards. But at the end of the day, what kind of impact do you, as a future radiographer, want to have?
That's the question, isn't it? As you move forward in your journey, I encourage you to really reflect on that. The most successful and fulfilled radiographers are the ones who are driven by a deep sense of purpose, who bring passion to their work, and who are truly committed to providing the best possible care for their patients.
Beautifully said. A huge thank you to RoleCatcher for providing such fantastic resources for anyone interested in exploring this incredible field. Be sure to check out their website, everyone. It's packed with information that can help guide you on your path.
And best of luck to all you aspiring radiographers out there. The future of healthcare is in your capable hands.
That's it for this episode of The Deep Dive. Until next time, keep learning, keep exploring, and keep diving deep.